Hello and welcome to our webcast for February 19.
January.
Oh,
Sorry.
January.
Sorry.
Oops. January 19, 2018.
Yes.
Yeah, I just tried to say 17. Sorry.
Yeah.
My name is Christian Debré, and this is Amy Asbold, the director of Toujours Vivant, Not Dead Yet.
Hello.
Also joining us, Taylor Hyatt.
Well, she isn't here yet, but she might arrive.
She might arrive, we wish for. Our policy analysis and outreach coordinator. Toujours Vivant, Not Dead Yet is a non-religious organization by and for people with disability and our allies. Our goal is to inform, unify, and give voice to the disability rights opposition to assisted suicide, euthanasia, and other ending of life practices that discriminate against people with disabilities. Today's topics: review of Canadian disability rights legislation, the New Brunswick. Second subject: Swedish activists question Oregon assisted suicide law. So Amy Asbrook will help us with it.
Okay. So, welcome back to our series on disability legislation across Canada. Today we're looking at New Brunswick. Like other provinces, New Brunswick has a combination of government programs instead of one law describing the rights of people with disabilities and the measures necessary to make equality a reality. So rather than having a New Brunswickers with Disabilities Act, they have some government programs. And actually, it's not a bad setup. It's pretty similar to the Rehabilitation Act in the United States, so it's fairly comprehensive. First, the Provincial Building Code received a significant update in 2011. In new buildings for public use, the following elements must be barrier-free. Main path of travel, doorways,
logical,
showers and bathtubs, counters, water fountains, at least one out of every 2 building entrances. Washrooms must be barrier-free unless they are in a business area measuring less than 500 meters squared that is completely separated from the rest of the facility. So if it's a really small business and, you know, it's separated from the rest of the building, then no, it doesn't have to be accessible. Waiting areas must have spaces for mobility devices, and the number of accessible parking spaces ranges from 1 space in a lot of up to stalls to 10 spaces for lots with 1,301 stalls, and increasing by 1 accessible space per 400 stalls. It's kind of low, but at least there are some accessible spaces. And, you know, if the community puts pressure, then they might increase it. So
yeah, this is the minimum.
Right. The building code requires access to hotels and apartment buildings. 5% of hotel rooms and apartments in buildings of more than 20 units must be accessible.
Seems a little bit low because we are something like 17% of the population.
Yeah, and even though that 17% isn't all people with mobility disabilities, it still should be a little bit higher than 5%.
Yeah, it's a little bit low.
Yeah. Small lodgings like bed and breakfasts, beds and breakfast, of less than 10 rooms are exempt from the accessibility requirements, which is fairly typical. Social assistance is available to cover basic living costs. Some people may also qualify for a supplemental disability payment, as well as coverage for medication, dental care, and eye care, which are not included in the regular Medicare services. So that's good. A revenue stream and additional health coverage. That's a good thing. The Disability Support Program provides a number of resources such as respite care, personal assistance within and outside the home, and supports community involvement. So, je pense que tu devrais.
J'ai perdu le panneau.
Oui.
Sorry.
Fermez la porte, mon amour.
On est en train de faire notre émission. Bye. Dans une demi-heure.
So it provides support for community involvement, life skills training, transportation support, technology and assistive devices, and services in residential institutions. So fairly wide range of services. The Family Supports for Children with Disabilities program offers assistance for which families are expected to contribute as much as they are able. Services include respite care, transportation, meals, and accommodation to access medical services, which is really helpful because if your child has to have medical services and you need to take them to a doctor far away, you need to have a place to stay and have meals and stuff. Parental education, some therapies, child care for youth over 12, and some medical items.
Over 12.
Right.
Probably it's because people with the cognitive difficulties. Yeah.
Right, intellectual, yep. The Health Services Convalescent Rehabilitation Program helps people access adaptive equipment when costs are not covered by other agencies or private health insurance. Examples of equipment include mobility aids, toilet and shower seats, grab bars and rails, lifts and transfer boards, and hospital beds. So looks like it's pretty, well, yeah, it pretty much covers the ground. New Brunswick has 5 programs to help disabled residents find work. The Work Ability Program is a subsidy for employers to hire disabled workers. Now, we've talked about this before. It's kind of a double-edged sword. On the one hand, it's good that people get jobs, but on the other hand, subsidizing disabled workers sends a negative message about their value as workers, and that's not a good thing. And also, they can yank the subsidy whenever they want, and all of a sudden you're out of a job. It's not like you're...
So it's good and it's bad at the same time.
Right, because generally the employers don't have money to hire you, aside from the subsidy. They receive minimum wage for up to 40 hours per week, plus the employer's share of benefits, for example, a pension plan or employment insurance. The duration of the placement depends on the person's employment plan.
Seems to be fair and reasonably generous.
Right, but again, we don't know if there's provisions to yank the subsidy after a certain amount of time.
Yeah, and if the government put some subsidies in.
Yeah. Exactly. Yeah, exactly. How much the program is funded is another big question. One component of the Workforce Expansion Program provides partial temporary subsidies for hiring members of certain groups who are likely to be unemployed, including people with disabilities. The positions found through the program must eventually be full-time and permanent or long-term and seasonal. So that's another subsidy program. The Training and Skills Development Program funds co-op placements and grade 7 to 12 equivalent education if a person is already receiving provincial employment assistance. Fees and tuition and books. Fees for tuition and books are also covered. The Training and Employment Support Services Program provides people with physical, intellectual, psychiatric, sensory, and cognitive disabilities the skills and supports necessary to qualify for, obtain, and maintain employment. A client could receive an interpreter, assisted technology, or specialized tutoring for high school equivalency.
Up to now, we doesn't criticize more New Brunswick.
Right.
Seems to be fair.
Right. Their programs are fairly comprehensive and seems like they address the needs, both training the individual and getting the person into employment. They don't address the issue of employment discrimination, which is what anti-discrimination laws do. But, you know, at least they're covering the ground of preparing people for employment and providing subsidies for employment, which again is a mixed bag. The Equal Employment Opportunity Program provides jobs in government, in the provincial government, to Aboriginal people, people with disabilities, and members of visible minorities. So they're not just insisting that the private sector employ folks with disabilities, but also the public sector has to do it. The Premier's Council on Disabilities appears to do much more than its equivalents in other provinces. At least they do a better job publicizing what they do. They publish annual reports online every January outlining the work done in the past 2 years. Some highlights from 2015 and 16 were coordinating events for Disability Awareness Week, which is pretty typical, and meeting with a variety of nonprofits and government agencies. The contents of the minutes of those meetings aren't available on the website. The council's website includes a list of government and nonprofit services for people with disabilities, a community calendar allowing disability groups to advertise events, a classified section to buy, sell, and donate disability-related equipment. That's good.
That saved quite a lot of money over government.
Yeah, because if your spouse passes away and they had a wheelchair and you want to give it to somebody or donate it or sell it, then another person can have access to that wheelchair and they won't have to pay $45,000 for a wheelchair, which would be good. A list of employment and education resources for people with disabilities and potential employers, which is good. A career board for people looking to hire attendants, very important, tutors, or interveners. And a huge database of publications. Topics range from building codes to preparing for emergencies, to transition planning for teenagers, to gardening tips for people with limited mobility, and a directory of service for persons with disabilities. So, and I spent a lot of time visiting their website this week, working on this, and it is a pretty good website.
So New Brunswick seems to be the best of the one we have seen yet.
Yeah. Last but not least, New Brunswick has a few interesting recreational options. First is disabled hunting permits allow hunters who have permanent physical disabilities to hunt from a stationary vehicle.
Wow.
So they can basically drive into the woods, stop the car, and shoot.
Great.
If you're a hunter, that's good.
That's good, because there's a lot of hunter in those kind of provinces. And in Quebec, it's forbidden to shoot from a vehicle, whatever you are. And this is not fair.
Yeah. Okay. Also, provincial grants are available for organizations providing sport and recreational opportunities for disabled people. And public libraries have materials in alternate formats like audiobooks, talking books, and ebooks. Patrons can also use a computer with a variety of accessible software in order to view library resources. So that's it for New Brunswick. Moving on to Swedish activist questions Oregon-assisted suicide law. Fabian Stahl, a Swedish anti-euthanasia activist who attended the Euthanasia Prevention Coalition conference in the fall, has recently become aware of efforts to legalize assisted suicide in his country. Officials want to model a potential law after the one in place in Oregon since 1997. The Oregon law states that someone seeking assisted suicide must have a terminal illness, in other words, an incurable and irreversible illness that will, within reasonable medical judgment, result in death within 6 months.
Which seems to be, let's say, fair, because...
If you look at it on the surface,
yeah. But you will know.
Right. There are a lot of problems with that. Mr. Stahl exchanged emails with Craig New, a research analyst with Oregon's Public Health Authority, the government body that oversees the Death with Dignity law, as it's called there. He later sent a record of the conversation and an article based on it to the Euthanasia Prevention Coalition. So that's where we're getting this information. While none of the information is new, the exchange pointed out some of the most troubling aspects of the Oregon law. And it's important to remember that this isn't new information. Nothing has changed in Oregon. Somebody was saying earlier this week, well, I thought it was stricter before. No, it hasn't changed.
Nope.
It wasn't stricter before. This is why disabled people have always been up in arms about Oregon. Okay. The definition of terminal illness applies even if the person's condition is chronic and health is maintained with regular medical treatment, such as insulin for diabetics,
which I am,
or dialysis for people with kidney failure.
So, if I was living in Oregon, I was legally granted to be.
Yep, he would be eligible for assisted suicide.
For at least 2 different reasons.
Right. The person will be considered terminally ill, even if they refuse life-saving treatment or treatment for a chronic condition. In the words of the staff member, the law does not compel patients to have exhausted all treatment options first, or to continue current treatment. If the patient decides that they don't want treatment, that is their choice. The patient gets to decide whether all hope is gone.
So basically, the people who voted this law are the kind of people who look to somebody on the side of a window on a 10-story. Jump will cost less to the government.
Right. Basically, we don't object to the idea of people refusing treatment. If somebody says, I'm done with treatment, that's their business. What we object to is when the government lets that person have a doctor kill them, as
which is basically follows. A murder.
Right.
Whatever the amount of living is still in this person.
Or in the case in Oregon, the doctor prescribes the drug.